Hi, everybody. I'm just giving it a couple of minutes. Welcome to our Championing Women Living with Hepatitis, celebrating International Women's Day. I'm just going to give it a minute because I can see that the numbers of people are coming in and it's rising quite quickly. So bear with us if it's a little bit quiet for a minute, just while we let people come into the meeting. Okay, I think the numbers are slowing. I think we might have more people coming into the meeting, but I'm going to make a start anyway. And I'm going to say again, so welcome everybody. Thank you so much for joining us today. I'm super excited to be chairing this meeting. It's fantastic to be here, and I have four incredible women who are going to share their experiences with you. Sorry, my name is Rachel Halford. So I am the president of the World Hepatitis Alliance, and this is my first year as president, so I'm delighted to be chairing this. So we have a running order today. We have the four incredible women who I'm going to introduce to you in a minute. And we are then going to have a few questions and just a discussion for half an hour about lots of different things. You know, hepatitis affects women in many different ways. So we're going to have an opportunity to talk about that, to talk about maybe some of the stigma. And then we will open it up, and then we will hopefully have a more interactive session with you guys out there. I just needed to say for those of you who are Spanish speakers or French speakers, we have got the interpretation. So you just have to click on the button at the bottom. I'm not the best IT person, but I think the slide there is showing you exactly what you do, the round button there with the globe. Click on there and it will tell you, you put in which language you want, and then it should, in theory, if you've got any problems at all, please put it in the chat and we'll see. We've got other people supporting us with the webinar. They'll be able to pick up and support you if you've got an issue with it. Okay, I don't think I need to say anything else about me. So I think that I should go on and introduce you to our fantastic panel. Each of the panel is going to give you a little bit. I'll let them introduce themselves, actually. So first of all, it gives me great pleasure. Here we go. Here we all come to introduce you to Shabana. Shabana Begum is the National South Asian Project Coordinator at the Hepatitis C Trust in the UK. Shabana, do you want to do a little bit of introduction?
Yes, of course. Good morning and good afternoon, wherever you are. Thank you, Rachel. My name is Shabana Begum, and I've been working with the Hepatitis C Trust for the past 14 years. That came about because I actually was tested and treated for hepatitis C almost 20 years ago, and discovered that there wasn't a lot of people wanting to talk about Hep C within the communities. I was then approached by the Hep C Trust and the NHS. We did a lot of media work, i.e. interviews and TV adverts, which led me to actually start working with the Hepatitis C Trust, paved the way for me to get into the South Asian communities, i.e. mosques, temples and community centres, raising awareness and actually testing people for hepatitis C. We discovered later on that 1 in 50 in the UK are estimated, so this is people from the South Asian community, to be actually living with hepatitis C, and unbeknown to them that they actually had the virus. Whereas 1 in 10, you could say, or 20 in Pakistan actually have the virus as well. So working with the communities, discovered that there was a lot of stigma. And I found it very difficult to actually being from the South Asian community, being able to talk about the virus, because they actually thought it was sexually transmitted, a dirty disease, whereas the transmission routes are very, very different from our regular drug users, so to speak, i.e. through razor blades and therapeutic injections. In Pakistan, they think taking an injection, and I'm sure it's like this in third world countries as well, that the patient actually thinks this quicker, the medication work quicker via injections rather than taking oral medication. So they're very, very common in Pakistan itself, and obviously with treatments abroad as well, be it dental or medical treatments or piercings. So these are the most common transmission routes within the South Asian community on how to catch hepatitis C. I've been working, like I said, for many years now within the communities, and I've learned different things from the communities. I've actually had, after testing people, I've handheld people through treatment. But a lot of the folk that I've helped treat, i.e. the men in the community, they still don't want their partners or their families to know they've had this virus. Whereas of late, the women that actually get tested and treated, they're willing to come on board and work as peers. I've actually been fortunate enough to work not only in the communities, but also in prisons as well, to raise awareness within the South Asian community in prisons. And seeing an Asian face, they actually come forward and say, okay, we'll get ourselves tested because you seem to be from our background and we really do want information on this and for you to test us. So it's been very, very positive for me in the long run. Sorry, I'm slurring a bit here. But yeah, it's been very interesting. I've been very fortunate to be working with the Hep C Trust. We have our teams, community teams, prison teams. We work with people, homeless people on the streets. When COVID took place, we were still working full time as well. Well, our teams were out there trying to eliminate hepatitis C, and in some cases, we actually, I think it was in prisons that we were actually able to eliminate hepatitis C. I'm very passionate about it, reason being that not only myself suffered from hepatitis C, I've had half my family pass away from hepatitis C in Pakistan. And it is very, very close to my heart. I think testing and treating is absolutely amazing, but getting the information out there, and us as women are educators within the households, within our homes, for our children and families. And if we can get other women educated on hepatitis B and C, that would go a very long way into raising awareness, even from the younger generation as well, get them interested in it also. Thank you.
That's brilliant, Shabana. Thank you. And just to say that you've just done a video with WHA. You launched a campaign video, Shabana Can't Wait. And if anybody's interested in seeing that, the link will be put into, it's there now, into the chat box. Thank you. And I should have said at the beginning that all of us that are here today, so myself and all our panel members here, everyone has been affected by or has hepatitis B or C. So I'm going to move on and introduce you to Marinela Debu, President of the Romanian Association with Liver Disease. Marinela, lovely to see you.
Hello to everyone. I'm very happy and proud to be part of this event. I think it's very important to discuss, if it is for Women's Day, to discuss about hepatitis in women, because I think it's very special. It's very special because in general, in majority of the country, including my country, women are very interesting about healthy, about testing. Women are the person who tell to their family, please testing, please make it something for your healthy. And I discovered my hepatitis B in 2006. I see in these last 15 years, time when I work in my association, I work with different women. I remember when I was pregnant with my first child, in the same time, I discussed with one woman who have hepatitis B, also like myself, and she have a lot of problems with their hepatitis. Unfortunately, she was one of the women who, after the pregnancy, transmitted the virus to her child. If they make it all the necessary, including vaccination and immunoglobulin. Unfortunately, so it was a rare cases when it was impossible to stop the transmission from mother to child. And unfortunately, it is a daughter. And I see the stigma from the woman level and child level, because I think it's much more it's more impossible to talk in the school about hepatitis. In this day, we must discuss not just about hepatitis of women, and also about hepatitis in children. Because if the children say at the school, I have hepatitis, and in general, no matter the disease, but when it is an infectious disease, I think they will have problem with their colleagues and in general in community, and be sure they don't talk about in the school. And this remain a problem about stigma. In these last 15 years, I saw from my personal experience and also experience with patient, some are changed in good way in all the country. In my country, we have access to the therapy, we have access to the investigation, but from some population, we don't have this access. For non-insured person, for example, if you are in a small county, if you are in rural area, it's difficult to have access. For different or cultural, can to be influenced, religion, or some personal issue, some familiar issue, can to have an influence in access to the therapy or access to the doctor, no matter if you have hepatitis B or C. After the COVID pandemic situation, I think in some part of the country or some part of the group population, stigma was increased. Unfortunately, I think all of us, we are affected about vaccination. Anti-vaccination and anti-vaccination in general affect us. And I think from short and medium time, this won't be better from hepatitis transmission, from hepatitis B transmission. I remember in 2006, 2007, if you say somebody you have hepatitis, majority of the doctor tell us you cannot to remain pregnant, you cannot to have your child or something like this. 17 years later, 18 years later, a lot of things are changed. This is hepatitis, it is a common disease. But unfortunately, stigma remains. Stigma remains when you want to have a jobs with involved in children. For example, if you want to work in alimentation part, or if you want to work in kindergarten or in the school, to have hepatitis can be a problem. And I think it's not just in Romania or in Europe, I think in all the world. Sometimes people can be very suspicious if you have hepatitis B. I see hepatitis B because I think in majority of the country, hepatitis C is not a problem. It's a problem just for some groups. If I talk also about my experience, I remember first time I say to all the people, I say, I am a person with hepatitis B, and we must have courage to say, we are here, we don't have a problem to give your hand with you, to discuss with you, to work like you, to be like you. We are not different. I think if you want to change the stigma, we must work daily by daily in this, no matter where are, because let's see, we are in this webinar from different parts of the world. Some things are like as well, some are different, but we must recognize we are influenced by religion, by culture, by local tradition. Stigma can be influenced by this. Access to the works from women with hepatitis can be influenced about this. But in the world, in the final, we are women who want to change this in our country, in Europe, in all the world, with our experience, with our role day by day, to increase day by day access to screening, access to therapy, and of course, access to the works, to a good jobs for women with hepatitis B and women with hepatitis C. And of course, we don't want to have in mind women with co-infection, with hepatitis B and Delta, with hepatitis B, C, and Delta. This is a main problem for some country, from my country, for example, because we don't have access for women with hepatitis B and Delta, and in general, to the new therapy, and interferon, for my opinion, interferon can to be not, I think interferon can to be second decision, not first decision in these days. Unfortunately, a lot of women don't have access, and a lot of young women. And we must discuss more about children with hepatitis. If we have children with hepatitis B in this period when we have access to the vaccination, it is a main problem from short and long term. Thank you. And if will be the question, I'll be open to.
Thank you, Marinela. That's amazing introduction. And also, I think really important points you raise, and I think we'll get an opportunity in a minute to discuss them a bit more. It gives me great pleasure to now introduce you to the wonderful Annie Madden, who's Executive Director of Harm Reduction Australia and Project Lead with International Network of People Who Use Drugs. Annie, welcome.
Hi, thanks, Rachel, and good morning, good afternoon, good evening, everyone, from wherever you're joining us from. Yes, my name is Annie Madden, and I'm based in what's known as Melbourne, Australia, but is actually the unceded lands of the Wurundjeri people of the Kulin Nation. As Rachel has said, I currently work for a national organisation here, Harm Reduction Australia, and part of the week, and the other part of the week, I work for the International Network of People Who Use Drugs as a research and project lead. Part of the reason I have come to work in those organisations is I've been involved in the drug users movement, both here and in Australia, for over 3 decades now. Prior to working with INPUD, I was the CEO of the Australian Injecting and Illicit Drug Users League for close to 20 years. So that, I guess I started doing that work many, many years ago because of my own history and background as a person who injects drugs. I've been an injecting drug user for a long time. I'm on methadone treatment. I've been on methadone treatment for many years as well and continue to be. I had hepatitis C when I was treated for hepatitis C. I'd had it probably for at least 20 years at the time, like many people have long-term infection before they are treated. I had, stage 2, borderline 3 fibrosis when I was started treatment. I was lucky enough, because of my work, to be very heavily involved in the advocacy in relation to the new direct-acting antivirals. They became in Australia in 2016, and was one of the first people to be able to take advantage of those new treatments, which I was very grateful to have the opportunity, because I had many friends and people around me who had done the previous treatments, both combination and monotherapy with interferon and ribavirin, and I know how difficult those treatments were for people. So I was very grateful to be able to hang on to have my treatment with the new direct-acting antivirals, as I say, in 2016, and had a great result from that and cleared it, and have been able to really repair a lot of the damage that my liver had sustained, which then allowed me, after my treatment, to do a PhD in 2018 and finish that in 2022. And that is how I ended up sort of now being very much immersed in community-led research with the International Network of People Who Use Drugs. We have a very strong agenda around our role in making the evidence and us being able to lead and conduct our own research and make our own findings to support our own advocacy. We think that's really important because the narrative, as we've already discussed with a number of people's introductions already, the narrative around hepatitis, viral hepatitis, other issues in relation for us, in relation to people who inject drugs, are very much affected by the narrative in time. Part of my work recently in that space has been leading on values and preferences work for the recent WHO consolidated guidelines for HIV, viral hepatitis and STIs, which we were very much involved in, and were able to do some really groundbreaking values and preferences work with people who inject drugs around the world to really lead where those global guidance from WHO, you know, what it said and where it headed, and that sort of guidance, as many of you will know, is so important for what gets done and doesn't get done on the ground, and provides the kind of statements that our communities need on the ground to be able to make the case for different programming and services they need. So I was really pleased to be able to be involved in that work. And now my work with INPUD is involved in a really a new multi-country research and implementation project that is looking at simplified and pathways for hepatitis C treatment for people who use drugs in low and middle income countries. And I'm just so proud to be part of that work and learning really new things all the time from my colleagues and community people that I'm working with. But there is still so much to be done, and in particular for women who inject drugs and women who are living with viral hepatitis. So that's my work as it moves forward over the next few years, and my bit on my personal background, but just really pleased to be here and support the discussion tonight. Happy to take questions. Thank you.
Thank you, Annie. And I think you're absolutely right. There is so much more to do, particularly for women. But it gives me such a pleasure to introduce you for the final introduction to Sylvia Baji, who is from the Hepatitis B Foundation Storyteller. Over to you, Sylvie.
Good morning, everyone. Good morning, good afternoon, good evening. I'm so happy to be on this panel today. I am Otoma Sylvia Obajoye from Nigeria. I am somebody living with hepatitis B. I discovered I was hepatitis B positive. That was 10 years ago when I was pregnant with my first child. I was like 8 months gone. I never knew, there was no symptoms, nothing. I went for antenatal care this particular day. I had moved from a particular state to another state. So I registered again for my antenatal in the new state. And I was asked to go through all the series of tests I've done before, then hepatitis inclusive. And it was so devastating to find out that I was hepatitis B positive. It looked like my world had come to an end when they told me how dangerous. So I lived with it till I gave birth to my child. Okay, I had to ask for the prevention and all to my unborn child, and I was told they would. It was very expensive as at the time, and it was not even on ground. So we had to go to a different state to get it, far away, and the potency again was at risk. I was told they had to bring it in a cool pack and all of that, so it could still, the potency would still be valid and all. So they brought it, we got it, and it was administered to her. So a lot of people do not even know they are living with hepatitis, and that is a huge risk as it is. A lot of people are not aware of the virus, and it is as close as ever. Somebody sitting next to you might be infected and they are not even aware. So this is where awareness creation comes in. I would want with awareness the world. My needs more awareness. The government, agency, SOs, and everybody to come to get this particular virus so we can. A lot of people don't know that when they are diagnosed with so this is what I want. Celebrating the International Women's Day, I want to this cause because it is a good cause. Nice.
Hey, Sylvia, do you know your camera, your sound went just near as you got to the end. I don't know if you turn your camera off, do you think it will make the sound slightly better? Just say what you wanted from International Women's Day again, because I was in there with you and then I suddenly missed that last bit that you said.
Okay. Today and tomorrow being the International Women's Day, and we said this program today, I want all of us, all the women all over the world, all over the globe, to lend our voices to push this cause so that every woman, every child, everywhere would live a normal life, living with hepatitis all over the world, so we can know that it is not the end of the world. We can thrive. We can live like every other person. We are not less of a human because we are diagnosed with the virus. That is what I want. Yes.
Oh, I'm so glad that you were able to say that again and you didn't get cut out. Really powerful. Thank you so much. Absolutely. Thank you all so much for introducing yourself. So we've got a few kind of things to discuss, and I think that, should we just see where we go and see how it flows? For everybody who is here, which is great. Goodness me, there's 73 people here now. That's huge. That's brilliant. If you've got questions, put them in the chat box, and there's going to be an opportunity in a little while to hand it over to you guys and see what any questions that you have. But let's all, so where should we begin? So shall we, maybe, I think you started it there, Sylvia, what are the unique challenges do women living with hepatitis face? I think you started it, the questions there. I don't know if any, and children, Marinela, you said about children. I don't know if there's anything else that you guys want to say about, the unique challenges that you think women face, or it's not we think they face, we know they face because we are women, that.
If I can?
Yeah, absolutely.
In the last 2 years, I was involved with the communication part of some program with European funds. And I see 70% of the person who are testing was woman. And I discussed with some woman who was discovered with hepatitis B or C. And I saw sometime a lot of women with hepatitis B, when they discovered they have hepatitis B, they told me, why I don't discover before? Some women have children and they was testing in pregnancy. In my country, it's currency to be testing in pregnancy. But in some community, in some local community, some ethnic community or something like this, women don't go to testing for hepatitis. And they discovered they have hepatitis B. First question it was, what I need to do with my children? I think when you are a woman, you are more interesting to know not just what is happening with you, but first question it is, like it was told before, what is happening with my children if they will have hepatitis? Because from my point of view, it's very important for us like women, to explain to professor in the scholar level, in general, to give this message: hepatitis is not a stigma. Hepatitis is not the end. Hepatitis is like other disease. Hepatitis is treatable if you have hepatitis C. Hepatitis B, can to be with. I think the problem it is in some country when we don't have access to the therapy, and this is the main goal, but it's not the situation in Romania. In Romania is the situation for hepatitis B and Delta, unfortunately, in this moment, when we have just interferon, and I don't like it, this situation. But I think we must discuss more about the role of the woman in the middle of this situation, and importance of the woman, and to help women in relation with their family. I remember a few months ago when a woman called me and they told me, I don't know what to do with my husband because my husband accused me I'll give my hepatitis to our future children. And she was destroyed. I discussed with her hours by hours to help her to explain to their family what needed to do, and to understood is not the end, and that she won't be guilty, and she don't give hepatitis to their child if she discuss with the doctor and make all the necessary things doctors tell. I think we like women must to make our voice more power, and I think a meeting like this help us in this direction.
Yeah, but I was just thinking, you know, there's actually a question came up in the box at the same time. I think there's many different levels here, isn't there? So we're talking about hepatitis B, and we talk about the stigma across it all. But I think there's also something about women's ability to access services, particularly if they are in need of women-specific services. And, you know, I mean, so the question came up about refugees and migrants, but just before we go to that, you know, we work, you know, women in prison, for example, the rate of hepatitis of women in prison is far higher than the rate with men, because women don't look up, you know, they look after themselves last, you know. And I mean, I guess, Annie, you'd be able to comment on this, you know, in terms of injecting equipment, they will be the last person to get the new needles, you know. So there's something about, you know, the position of a woman in a relationship, and then when she's trying to get support, you know, where does she go to get support, and the shame, because you're a woman.
Yeah.
You know,
yeah, I think the shame is the main problem sometimes.
Yeah, I mean, I don't know what, you know, whether you know anything about the kind of the needle and syringe use amongst, you know, differences with men and women, Annie, and the availability and the accessibility.
Yeah. I mean, as you've outlined, Rachel, there are, and this is one area that we do have some research in, some qualitative research, not heaps, but in some countries we do have an understanding that there are, you know, very gendered issues around sort of access to services, particularly harm reduction services. In many cultural contexts, you know, there's like women are sort of made absent, if you like, you know, they're not even meant to exist, female injecting drug users, you know what I mean? It's culturally not, you know, it's kind of taboo. So then there's no discussion about that. So then there's no services to it, you know, it just goes on and on. So I think, yes, and there are, you know, there's, you know, mixed in with all of that, gender-based violence is another issue that, you know, is part of this picture. I think, you know, one of the things that was occurring to me, I totally agree with you, Rachel, around women and how they care for themselves. You know, just in the last 10 years, I can hand on heart say I have lost 3 female friends to hepatitis C related, because they put themselves last, really. And it's not just that they put themselves last, they're so busy caring for everyone else around them, but people let them do that. So even when people see service providers, you know, they don't really see the women, they don't ask the right questions, they don't encourage women to put themselves first and to have their needs met. You know, it's always kind of, focus on the needs of others around them. And that, as you say, goes, you know, including access to needle and syringe programs, but it's a much bigger it's a much bigger issue for women generally about our access and our needs. Yeah.
Yeah, and I guess Shabana, when you were talking about Pakistan, I'm guessing that, I mean, I know by nature the woman leads the family, holds the family together in Pakistani culture, but the acceptability or the ease that a woman in Pakistan might have in coming forward and saying, I've got hepatitis, and absolutely it's a different route. But my sense is that a woman in Pakistan, or I think someone just put a message in Nigeria, wherever, that it's difficult wherever a woman is listening for them to get access to, or for them to be able to speak out and be central.
I think you're right there, Rachel, because I think even from my own experience, when I was diagnosed, it was like, who do I tell? Where do I go? And even in the home, my mother told me not to talk to anybody about it, because she basically said it's quite shameful that your husband may have been somewhere to have caught it and then passed it on to yourself. Again, it's lack of education that's happening. And she made me feel shameful for something my husband might have done. But obviously, when I found out how I'd contracted it, it was totally different means. But having to access or go to clinics, I mean, at that time it used to be sexual health clinics that were more aware with giving out information. And even now, if you ask somebody to go to a clinic or anywhere like that, oh, somebody might see me, and it would be frowned upon that I'm going to go and try and get some information regarding hepatitis. People point fingers. So it is quite, you could say, damning that women are having to face that situation, that not having access to healthcare easily, even here in the UK. If you're going somewhere, people will ask, oh, why are you going? Where are you going? They don't tend to mind their own business. And they start pointing fingers. And being like the head of the household is quite difficult, because you're then forced to actually look after, even though you want to look after yourself, there are measures there in place that your husband comes first, your in-laws come first, or your children come first before even you. You've got all those responsibilities before it actually comes to you. So we have to overcome all these, and I think the only way for that is, again, education. And I'm very pleased that we're on this platform being able to talk about these issues.
Yeah. What about and I know we're going to go back and do questions later, but this question came up and it fits in perfectly with this, and it was Philippa Easterbrook asking, the special situation of women who are refugees and migrants. I mean, we all live in countries. I mean, Sylvia, I don't know, for what's your experience in Nigeria of refugees and asylum seekers. You talked about how difficult it was for you to go and get medication and treatment. But when we think about, and we've all talked about, the differences, or the struggles women have. But when we think about a migrant or an asylum seeker, a refugee, the barriers for them surely are going to be exacerbated as women, on top of the fact that they are migrants or refugees or asylum seekers. You there, Sylvia?
Oh, sorry, you're talking to me, right? Oh,
No, I was just wondering what, yeah.
Okay, the question is directed at me, right? Okay.
Yeah, I just, your experience of refugees, do you see that, and you talked about how difficult it was for you. I mean, how difficult must it be for women within Nigeria, particularly, in terms of if they're refugees and asylum seekers as well.
Okay.
Or migrant populations.
Okay. For me, being a free person, and I was not able to get it easily, to get the medication easily, talk more of people who are in IDP camps, who are in asylums, who are in prisons and jails and what have you. We would like to advocate to government agencies, CSOs, and all to make these medications available at every, I don't know if they can make it available at prisons, at IDP camps, to make it easy for these people to have access to these medications. I don't know if there's a way they can work on that to help people who do not have free access to all of this. And the thing is not even having free access to it. Can they even afford these drugs?
Yeah.
Financial constraints.
Yeah.
Huge.
Yes. So how about people who are free like myself? What if I'm not working due to stigmatization and discrimination, and I do not have access, I don't have funds to access these drugs? So if there's a way they can make, like, give subsidies for these drugs, for these treatments, it will go a very long way to help us live a healthy life and to thrive as humans we are.
Yeah, and you know, one thing I really think is that we as women are really good at raising the voice and rallying around, you know, but when we're in these situations like this, but also a few of us, you know, getting a few women together to make a plan and lobby, you know, we're good at that. We're really good at that. It's just that it gets separated out. And I guess, yeah, it does get separated out. So
I think, you know, one of the issues that Sylvia's raised for me here is that it's not even access to treatment either. In many countries, women don't have access to even antibody testing, let alone diagnosis or treatment, you know, so people don't even have a way to know their status and make informed choices and access what's available because they can't, you know, or it's not affordable. It might be available, but
not affordable. Yes.
Yeah. So these are massive issues. Yeah, agree.
So what's the answer? So apart from, you know, donations, or is there something about, I mean, if we were talking about migrants and refugees, is there something about lobbying so that there was access to testing and to treatment, you know, because, you know, in a majority of, I come from a high income, very privileged country where it's free healthcare. Australia, almost free healthcare, you know, other people, health insurance, you know, but you know, what can we do? You know, is it about lobbying so that migrants and refugees, people who are particularly vulnerable, women who are particularly vulnerable, there is an access for them? You know, I don't have, I mean, I don't have that answer, but it would be great if somebody had any suggestions. Because
I mean,
think,
some of sorry, I know I feel like I'm talking a bit, but some of the work that I mentioned that I'm working on with INPUD at the moment, the Cuts Hep C project, is funded through an organization called UnitAid, which is associated with SHO. And one of the whole things that UnitAid are about is sort of taking, sort of making more accessible, if you like, effective treatments and other commodities, harm reduction commodities, whatever, in places, low and middle income countries who otherwise wouldn't have access to those things. And certainly the research that we're involved in is, as I said, it's implementation research. So the whole point is not just doing research for research's sake, but research that has an implementation arm to it that shows how that particular technology or the treatment or whatever it might be, commodity, can be made available in accessible, appropriate, culturally sensitive ways in that environment, and then doing the advocacy, having the data, information, and the on-the-ground experience to build the advocacy case and to do the market shaping work that's necessary to sort of then take that to scale. So, I mean, these are some of the sorts of things that can be done, but they're, you know, big investments. And this is the first time that UnitAid has ever invested in hepatitis C and harm reduction. It's the very first time. It's a big investment. It's $30 million. But it's 10 countries, you know, and it's a small start, even at that amount of money. It's a small start. So there's lots of strategies, I think, that are needed. That's one sort of example. But you're right, you know, advocacy by and for women, I think, is extremely powerful too, and needs to carry, you know, this along too. Yeah. I
think what the other powerful tool would be is having languages as well, information in different languages, readily available, videos, CDs, because not a lot of people can read or write, and we have to take that into account as well. So something visual would be really good as well.
What are you, I think that, you know, I mean, I guess the question I'd ask you, Annie, then is, so within that enormous piece of work, is there anything that's channeled at women specific? Because that's the other thing is that I think, we just about, in terms of the criminal justice system, have, women specific prisons, and we have fought like mad over the last 50 odd years to have, domestic violence, refugees, etc. Drug services, not many women specific services. So, where there's something, and in terms of hepatitis, when I was diagnosed in 1998, there was nothing women specific, and I started working at the within hepatitis in 2015, and there was nothing for women, and there still isn't today specifically for women. Here we are as a group today celebrating International Women's Day, but where are the women specific services?
Yeah. The appalling reality is that it's very difficult to get donors and funders and governments interested in women-specific services, in my experience, particularly in relation to viral hepatitis. That has been, the experience I've had in various countries and regions, not just in Australia, but I'm not sure what other people have found, but it has been very difficult to get that interest in a way that is consistent, substantial enough that you can take things to scale, to go beyond a pilot, those kinds of ideas. It's very hard. It's very hard.
I think we must discuss a different situation in different country and territory. Because if I speak about my country, I come from Romania, like I said before. In my country, from the last 25 years, women, and last 10 years, women with hepatitis, women who are pregnant, have possibility to get testing in first part of the pregnancy. It's free. I think some part of the women don't know about this, or don't want to go, or thinks if I don't have any symptom, I cannot to have hepatitis. We must to see, and also this part of the perspective. Sometimes women don't know her right, don't know they have possibility to testing free if they are pregnant, or for example, from 2018, family doctors can prescribe this test, antibodies test in my country from some part if you are insured. And sometimes things can be a problem, like a line. If you are non-insured, you don't have any chance to be testing. Or can to have a chance to be in some European funds, or to be testing by NGO, or from some doctors program, also some private funds. This is happening in my country, but the main question remains, okay, you are testing, you discover your hepatitis B and C, and what it is next step? What is happening with you? Because it's not enough to test to know about hepatitis. It's very important to help all the women to have access to the therapy, to information, because if we want to stop it, the stigma, if you want to help this woman to works, normally works, no matter the domain, they must to know transmission hepatitis, correct hepatitis transmission. Because sometimes people think, okay, you have hepatitis B, if you give me your hand, you give me hepatitis. And we must to help women to be protected and to learn about her protection.
Yeah.
In a lot of countries, in my country, have a lot of good legislation. We have a lot of good things, but we discuss about prison women, but we must to discuss more about rural women. In rural area, in all the country, it's much more difficult to have access, no matter what are you, because sometimes you tend to be at 10, 15, 100 kilometers from the hospital. And if you must work at your land, sometimes you don't have time for your healthy. I can to speak, if one family, woman and men have hepatitis, be sure in majority of the time, woman thinks, okay, first my man to be okay and to be with healthy good, and after this I will see what is happening with me. Sometimes it's happened in real case. Sometimes women are very conscious about her healthy and say okay to go together because we must to be a good parents for our children and to help for the future. But this depends on the cultural, about the local tradition, about religion, about a lot of things, and sometimes about the stigma in the family, because we see this sometimes stigma in the family. I see in the last year person who divorced because one of the member have hepatitis. I see grandmother or grandfather who don't want to give her a name, I see a lot of familiar tragedy and a lot of people who lost their jobs because of hepatitis. Day by day, this is changing because we work together to make advocacy, to make information, to have campaign. It's very important to don't stop it with this campaign. To don't stop it and to help our authority to understood they must to give money from hepatitis, from in general, from infections disease to stop it. And we must work to improve and to encourage vaccination, no matter if you are younger and if you are adults or children. Vaccination for hepatitis B is the only way to stop it and to make elimination. Of course, if you have hepatitis to treat, but first vaccination. And we must discuss more about vaccination, and we like women can to change things and to help this and to encourage people to vaccinate it if they are adults.
Yeah, I was just looking at I was listening to you, Marinela, and looking at one of the questions that we were going to talk, or one of the things we were going to talk about. How can we as advocates, how can we work together to support women living with hepatitis C, kind of on a local, national, kind of within our countries, but also on a global level? How can, what is it that we can do? Yeah, what can we do to change this? Because the reality is we've got a cure for Hep C, we've got a vaccine for Hep B. No one should be dying. No one should go and have a late diagnosis on Hep B. There should be a test. Every single woman who's pregnant should be tested. There should be vaccines. So, or the availability. So I guess it's, there's going to be something on a global level. But whether, I think that when you were talking there, Marinela, and I was thinking, is it about us sharing? Is it about us doing more of this, more of us about this is happening in this country, so this could be happening in this country? We seem to work in silos. We've got, UK here, we've got Australia, we've got Nigeria, we've got Romania, but we all work in silos. Do any of us work together? I'd love to, but I don't think we do, because I think we work in silos because our systems are all so different. So what can we do to share our experiences and our learning to support each other? How can we, I don't know, Sylvia, what can we do as a group to support you or women in Nigeria? Is there something that you would think of straight away that would really help that advocates could do to support?
Okay. Like I said before, my network is really messing up. Like I said before, the advocacy, the raising awareness is very key right now.
Yeah.
Because a lot of people have this perception that people living with hepatitis are people who live reckless lives, who like people who are promiscuous. You get me? Hello? Can you hear me?
Yes.
Yeah, people who inject drugs and all of that, not knowing people can actually even get this virus from birth, from transmission, from contamination from blood, even from birth, from their mothers, from a mother to a child. So what do you do when you find yourself, you're infected already, you have this virus? So does it mean you shouldn't live your life anymore? So we want advocates to leverage on the elimination response to address the challenges we face, like the stigmatization. Like somebody like me now who would want to go outside the country to gain more knowledge cannot even go to some of these countries because of the discrimination that comes with not accepting people who are positive into their countries. So what do? I'll be left in my country, in my remote village. Okay, I was privileged to have somebody who took me from my remote village into a city here in Nigeria, and I was educated. How about people who are not privileged? Like I met somebody like last week. She was telling me of how she wanted to help a girl, bring somebody to the city to educate her. But on finding out that she took her for series of tests and discovered she had hepatitis B. She had to take her back to her village. So what's the fate of that child? She would not be educated for life because she has hepatitis. So we want everybody. I don't know if you can lend your voices for our country to know that the government, the CSOs, everybody to come together to help us, because without you people creating the awareness, our mental health is even at stake. We suffer from anxiety. Myself, I have been suffering from anxiety for a long time now, since I discovered I had hepatitis B, and anxiety, depression, and everything. But thank God I met people who advocate, somebody like Catherine Freeland, like the past president, Danjuma Ada and the rest, Jessica Hikes and the rest, everybody who keeps motivating me to be strong. There's another person, Ola Sylvia, who is also is diagnosed with it. We keep motivating ourselves so that our mental health will not be a mess and all. Sometimes we try to stay above the waters to just face life as it comes, but somehow we still have down times. We have down moments. Yes. So we want you people, I don't know if there's a way they can, like bylaws, if they can erect bylaws guarding people living with hepatitis, to guard our rights to life, to the good things of life, to social amenities like jobs now. A lot of people are out of job because their employers found out they were hepatitis positive. So we want people like you to help us to create bylaws that guides our rights as people who are living with hepatitis, so that we can also thrive like our fellow humans. I don't know if you understand me.
Yeah, no, I mean, it's almost like we step into a different forum again, because what you're talking about is discrimination. And it's just, we live in a world which isn't, I'd go off on a tangent there, which I'm not going to do right now, because I think, there was there's some comments in the messengers, and, I guess practical solutions from the top down are, a lot of this is around stigma and discrimination and awareness, and changing before you even have anything to do with the governments, and I think that there is something collectively we can do around that. Absolutely. In terms of raising awareness. I mean, just to bring you in, Shabana, you work in the UK, but you go back to Pakistan. Do you see massive differences then in terms of what's needed for women in Pakistan compared to what women in the UK, for example, have access to? Do you see huge differences there?
There is a huge difference because of their lifestyles themselves. Here in the UK, we have easy access to healthcare, whereas in Pakistan, they don't. And it's like even if they do want to access healthcare, they need somebody to go with them. And then that person needs to be explained to of why you're going, you know. And I mean, I've just been back to Pakistan now. Then there's the even if they've got access to healthcare, one of my cousins actually got treated for hepatitis a couple of years ago. And she told me her story. And she basically said that when I went, I did the 3-month treatment on the new medication. And at the end of my 3 months, the doctor said, oh, there's still a little bit of Hep C left in you. Why don't we just to be on the safe side, do another 3 months? Whereas she didn't need to do that at all. So because she didn't have the education or the knowledge, she actually was conned into having another 3 months of treatment and had to part with some money. So I think, again, it comes back to education. And if we can actually get the information out there through either being TV channels or radios, you know, like we do on international, on World Hepatitis Day, 28th of July, globally, that is now coming together now that everybody around the world celebrates the one day. Maybe we need something in the pipeline that we can actually give out information as well regarding women themselves and their children, so that it is targeted for them, and they actually understand that, yes, if you're going through, I mean, I'll give my example. At the age, I was born and brought up here in the UK, but when I went back to Pakistan at the age of 13, because my father wanted us to be educated on the lifestyle that's different from here in the UK, I ended up being ill, and I went to the doctors, and the doctor actually injected me with a unsterile needle from where I actually contracted hepatitis C. So when the family actually found out that I had Hep C, they still wouldn't talk about it. I am going on about this, but we need more education about this in different languages, easily understandable, that we can, even as women, we have the right to healthcare itself, no matter where you are in the world. But it's getting that information across to them, finding different ways and means. I mean, it's taken us almost a year to put together, Rachel, a booklet regarding hepatitis C in English and in Urdu. But it's been very well received within the South Asian communities. They're going like hotcakes. So if we can translate that into other languages as well, that would be ideal. It's free information. And at least the person themselves, the women themselves, the individuals can make their own decisions as well, as long as they actually are educated on the topic. I think that is really, really essential. It's same here and it's same in Pakistan as well. Because they don't have that education, they put it on the back burner, that where we have to look after our families, we don't come first.
Yeah, I think there's within all of that, Shabana, which is brilliant. I mean, you said something about World Hepatitis Day, because there is a lot that happens then. And I think that, you know, the hepatitis community have managed to build up quite a bit of momentum and quite a loud voice. Why couldn't, you know, and I know WHO are on the call here as well, why couldn't we do something for women specifically within it? You know, we can pitch it. We could pitch it to the team and see, is there something, or, you know, there's the relay. Could we organize for women, you know, to kind of start to change the conversation, open up the conversation? It wouldn't necessarily get the funds or etc. straight away. We wouldn't get funds, would it? Wouldn't get funding for you, Sylvia, to go, you know, more funding, or for people to come from rural villages. But we could raise awareness, we could get the momentum moving, because it's about education, absolutely, raising awareness to change the stigma. And I guess the evidence, I mean, going back to what Annie was saying, that, you know, the reports that you'll be doing and the work that will come off the back of the Unitaid work that's happening will provide us with evidence, you know, because one of the we live it, don't we? We're women and we live it. But the problem is that in this world that we live in, unless you've got evidence, credible evidence, we can't get money, we can't change policies, we can't have influence. We have to have credible evidence.
And one of the great things I think about this particular work is that it has significant components of community engagement built into the whole process. So the whole project is overseen by a global community advisory board that is made up of people who use drugs from, 10 different countries, a few representatives from each country in different regions, and they are overseeing all of the formal research work and having input into that. There are values and preferences work, community-led values and preferences research happening. So this is about, us creating the evidence ourselves, and owning the evidence, being part of that process, or at the very least having partnerships, co-production of evidence and research, rather than people telling us what our lives are and what our experiences are for us. Yeah.
And sorry, go on, you go.
I was just going to say one thing, Rachel, that it's a bit of a slightly different issue from what we've been discussing, that all fits together, that I really did want the opportunity to sort of put into the discussion today. And for me, I think if we're talking about stigma and discrimination, which is really the massive issue, but for women who inject drugs, we can't really talk about that without talking about criminalisation and the war on drugs and the effect that has on so many facets. Those failed policies have on so many facets of our lives. It is the thing that drives the stigma and discrimination at the end of the day. It compromises our health and well-being. It sort of drives us into poverty and keeps us there. It drives us away from harm reduction services and access to the very means of prevention for viral hepatitis that we so need access to. So I think, in terms of, solutions and things that need to happen, we also need to look at systemic change, change at a structural level. That's just, one example of that, if you like. It's a very big example around prohibition and criminalisation. It's well documented, the harms that causes to people who use drugs, and especially women who use drugs. But I think, there's many other examples of structural change that are required to address issues for women in relation to viral hepatitis as well. Yeah.
Yeah, thank you, Anya. And I think really, really important. This is the perfect place to bring it in and to put it into that context. Definitely, definitely. There's actually a question that's come up. So we're actually have a half an hour here to discuss questions that people have put forward. And there was a question that came in from Motolani, and it's how are you able, or how were you able to overcome stigmatization? This question is for everybody on the panel. If any of you think you have overcome stigma or stigmatization, because it's a weird one, isn't it? So how Sylvia, how do you think? Have you overcome it, or how have you overcome it? Oops, you're on mute. Yes, there you go. No? No?
Still on mute, yeah.
Oh. Shall I come back to you? Yeah? And Marinela, what about you? How have you overcome stigmatization, or have you not? I think that's probably a better way of saying it.
I think we must discuss about stigmatization and psychical impact, because these are together. When I discovered my hepatitis, I lost part of my friends. Just I don't tell friends in this moment, but before, for me it was good friends, and it was my first time when I discovered the stigmatization from some disease. For me, before, I don't have this problem, and I think the most useful it is to discuss, to tell I am, and to repeat. If we want to lose stigmatization, we must to discuss day by day, and to give example, myself, yourself, and together. And I think also stigmatization come together with psychical impact. And sometimes you can't to solve stigmatization if you don't stop solve stigmatization, you also cannot to solve your psychical impact. because it's not just about a disease. It is about to lost people who do you think it was for you very important in your life. And also I think if we testing and more people are discovered with hepatitis, and we are a group of women with hepatitis, and we discuss day by day, also this help us in this stigmatization daily works to increase, and to also to help other women to have power to discuss about it.
Yeah, no, absolutely. Sylvia, have you got volume
Yes.
now? Yes,
I'm back. Okay. So, like you said, I have not totally overcome stigmatization and discrimination, because a lot of my friends and families, when they talk about this, when they talk about hepatitis, they talk about it with so much contempt and disdain. And these are people who means so much to you, who are friends and families, and they are not even aware you are living with this disease, and they talk in that manner. So I feel when we open up to these people without them being educated about the virus, they like try to isolate from us, and you understand.
Yeah.
So every day, every week, week in, week out, I get to find people who I believe even knows more about this particular disease, yet in the manner in which they speak about it, you are heartbroken. You can't even relate to them that, okay, you can't come out plain to tell them, okay, I am living with this disease, just because of fear of isolation and all. So like in Nigeria, we would need billboards, stickers to stick everywhere, billboards for them to come to the realization that this disease is like every other disease. It is not a death sentence. You can have hepatitis and live a normal life. I want to if we can get stickers in every street of Nigeria, it will be a great idea. Stickers and billboards, educational materials.
Absolutely.
Yes.
Yeah, totally agree.
Gradually, I know I'll get there where I'll be free from stigmatization and discrimination. It's a process. Yes.
Yeah, Shabana, thank you. And I love it. I had the vision when you said stickers everywhere of just all these bright coloured stickers, because it's about raising awareness, and it's about changing other people's views. We don't have to change anything about ourselves. We just have to educate other people. It's their problem, not ours.
We can also use social media. Yes.
Social media, absolutely, absolutely.
Yes.
Shabana, what do you think?
I think it's a brilliant idea, the stickers.
In terms of stigmatization.
In terms of stigmatization, obviously I experienced it a lot from my family and friends as well. Like Sylvia mentioned, and Marinela, that people close to you actually took a step back when they found out that I had hepatitis. That I wasn't allowed to hug my nieces and nephews, or my brothers and sisters, not being able to sit in the same room or use the same dishes. And I felt that it was literally like a death sentence. And it wasn't nice. But when I was educated by my lovely nurse, and when I joined the Hep C Trust, I learned more about hepatitis and what the transmission routes were. I was actually able to overcome that, thinking that, okay, I've not done anything wrong. I was 13 when I caught hepatitis C, and mother of 5 afterwards, when I actually found out that I had hepatitis C. And people were pointing fingers, like I mentioned earlier on. But again, down to education. Once I received that education, I was able to pull myself out of it and think, okay, if I've been in that situation, how am I able to help others? Because other women are going through the same thing that I've been through as well. And of late, been trying very hard to actually normalize hepatitis C, saying that a lot of people will go towards they're okay now about talking about diabetes and getting the blood tests done and BMI done and everything. And it's like, why can't we join that with everything else? TB receiving tests for the medication for TB, and then being tested for HIV, hepatitis, what do you call it? Sorry, I'm lost for words here. Being not just for B, but having the diabetes test done. It's very similar to what we do for the antibody tests, correct? So what's the difference? There's not much difference. A lot of people come up to me and say, oh, you're testing for for diabetes. And I said, no, we're actually testing for hepatitis C, in some cases B and HIV as well. And it's just to have an open conversation rather than being in closed rooms. I do understand that a lot of people get stigmatized by not having the information. Not only that, but having tests done in a closed environment, in confidential area. What I've actually done with the South Asian community is have tests done openly. So there's lines and lines of people, and people are waiting, looking on, or what's happening. They'll ask the question, you explain it's a hepatitis C test. Oh, that's all right, we'll get it done. So that is one of the ways that we've actually overcome some of the stigma within the South Asian communities. If you go to a mosque on a Friday, there's hundreds of people there. Even if they don't want to get tested, they'll walk away with some information. And people that do get tested are quite happy, and they'll pull in other members that they know, the friends and colleagues. We're getting tested, why don't you get tested as well? I think that is one of the main ways of overcoming stigma, normalizing hepatitis B and C testing. There isn't any stigma around it, and it's okay to get tested within community settings.
I love that. I think that's very similar to what Marinela was saying right at the beginning when she was saying, I have hepatitis, and she stands there very proudly and it's okay. I have no problem with standing here and saying I have hepatitis. And is there anything you want to say around that, around have you got rid of stigmatization or have you not? Because I think it's a huge thing, it's a big question. How were you because I don't know if we do.
It's a very big question. And like, I guess what I would say is there is no escaping stigma when you're a person who uses drugs. That's just the truth of the matter. We're a criminalized group of people. Our very existence is criminalized, and there's a lot of, we're one of the most despised group of people on the planet,
That's very true.
From a very young age to literally hate us. And there are plenty of people still in the world who will openly say that, great if people get HIV, people who inject drugs get HIV or Hep C, because then that might, kill us off, that type of idea. That's not an extreme idea to hear. People say those things still now, So I think, as I said to you, people, there's all sorts of ideas that people have done it to themselves. They've got what they deserved. These are very common things to hear. So I think that's very hard to live with that. And, so I often talk about stigma in relation to drug use, and then associated with hepatitis C in particular. It's very sticky. It sticks on everyone and everything around you. So, people use drugs, it sticks on their families and their communities, and it's a very shaming process for people. So, as I said before, I think the solution to that is that we need to deal with the criminalization. We need to deal with the very harmful war on drugs, which is really actually a war on people. And until we do that and we decriminalize and we allow people to live their lives how they choose to live them, we're not going to get very far in terms of destigmatizing people who use drugs. I'm afraid. I wish there was a better answer, but I think it is very much linked to the journey of decriminalization. Yeah.
My personal view is that, exactly the same. There's a question come in there. Just because I'm conscious of the time, we've got 10 minutes. So Oh, this is really nice. There's a comment that came in. You can probably all see it. I think it would be nice if we can create a WhatsApp group where we can easily discuss and learn more, work together to create awareness in hospitals, schools, churches, social media. I love that. And do you know what? That's not out of the realm, surely. You know, there's no reason why we couldn't, as a group of women, and I'm sure there must be, I'm not aware of any at the moment, but there must be some groups of women that come together like this. You know, it shouldn't just be because it's International Women's Day. It's, you know, we can celebrate being a woman every single day, you know, and it's a shame that it takes us this one day a year to come together and talk about how life and hepatitis and everything affects us. Conscious of the time, so we've got 9 minutes left. I just wanted to go around and before I say thank you to all of you, panel, and all of you that have attended, I just wondered if there's anything that you guys would like to, closing note. Sylvia, what would you like to end on?
I would like us to get like a support group where people with lived experiences come together to encourage each other, so that we would all know that we are all in this together. We are not alone in this race. So the burden will be a bit lighter.
Yeah.
Mm-hmm.
I love that. And you know what? You know, the sustainable health goals, no one is left behind.
Mm-hmm.
You know, that fits across the board in so much, doesn't it? I love that. Marinela, is there anything final words from you?
I want to say, if you are a woman, you are mother, and I think you must to have courage to discuss about your disease, no matter if you have hepatitis or other disease, to be open to discuss and encourage people to vaccinate. It's very important. Encourage people to go to discuss with a doctor, to go to the psychologist if they can't, because unfortunately sometimes you must pay for a psychologist. And be open to discuss about your disease with your husband, with your mother, with your family, because sometimes if you discuss, you tend to have a big surprise. Some person from your family or appropriate of people who don't know they have hepatitis, and to help her to testing and to discover it at time their disease and to save one life. If we discuss about hepatitis, we save not just increase stigma, but also we can to save more lives together.
Fantastic. I think that's a great note to Marinela. Shabana, any last words from you?
Yeah, I've just got the postman outside as well. Knocking. My last words, I think, again, the emphasis on education. That is from my experience, that is the only way to overcome stigma, raise awareness and get people together. Being a woman, I'd say it's up to yourselves to actually do that, not depend on anybody else. We do run the home. Majority of us run the industries as well. We have the power within ourselves to empower other ladies as well to participate, get educated, get them treated and tested and treated, and raise awareness everywhere.
I love that. Yeah, empower. Yeah, powerful final words, Shabana. Annie, last words, last thoughts. We still have a little bit of time.
Oh, I think, I mean, it's been such an amazing discussion and such important topics. It always reminds me when I come together with women, and particularly on International Women's Day, that, you know, we really have to focus on lifting each other up as women. I think that we are so important to each other. And I think we can do that by amplifying and kind of validating each other's voices and experiences, our diverse voices and experiences, and all of our different, you know, backgrounds and experiences in life, to really create, you know, a world where, you know, the health rights and dignity of women and girls are truly valued, you know. And I think we're a long way from that, but together I think we can strive to create that for sure. Yeah.
Mhm.
Yeah, I love that too. And I think that, you know, for me, you know, I mean, there's something about, I think we talked about it, it cuts across lots of different areas. You talked about it, and, you know, criminalization, everything. So maybe there's something about, we do this across the board. It's not just about hepatitis. We're here today talking about hepatitis, but it's about women across the board supporting each other in whatever, you know, because fundamentally, you know, there are differences and discriminations from the word go, being born a girl, you know, and I think that, and I don't mean that in a martyr way, I mean that is the reality, you know, and because in the back of my head, I can hear, you know, people I work with going, oh, what about the men? And it's no disrespect. It's absolutely no disrespect. It's about, that is the reality, you know, and then if you put health conditions or other choices within that, it's tough. It's really tough sometimes. However, it warms my heart, and I love today. I get lifted by it warms my heart, and I think, why don't I do this more? You know, why don't I guess because we are, as Shabana said, we are all strong. And we're independent, and we can and we are an industry, are leaders, you know, and I don't allow myself to come back to basics and remember the essence of a woman is this: it's coming together and being open and speaking and sharing with each other and supporting each other. Throughout the comments that have come on the chat, lots and lots of people have talked about stigma. So just as we end, I wanted to say that there is a stigma survey. It's being piloted at the moment. WHA are launching it. It's piloted at the moment just in 6 or 7 countries, but it will be launched globally. And I think within that, there is a part which is asks, you know, gender. And we might be able to get some more information there about how stigma impacts on women. You know, so you know, my final words from you, and I'm giving you 3 minutes back because I don't want to take away from the atmosphere that it feels that we leave on, is to say thank you so much for everybody, for all the panelists. You are stars, all of you. It's been fantastic. For all of you attending, thank you so much for joining us. And happy International Women's Day. It's actually tomorrow. So, and well, for Annie, it'll be very soon. For us, it'll be a bit later. But thank you all for taking time out. It has been, yeah, so nice, so heartwarming. Thank you. And we'll see you soon. Thank you very much. Bye-bye.
Happy International Women's Day. Bye.
Yeah.
Happy International Women's Day.